Hi, I'm Jacqueline Borden. I'm a student of Purdue Global University, and I'm going to talk about my evaluation process for my evidence-based practice project that I'm doing on heart failure. I will share my PowerPoint that I made with you. You can just give me a second. So, congestive heart failure, patient education, and evaluating the outcomes. About 6.2 million adults in the United States have heart failure. In 2018, heart failure was mentioned on 379,800 death certificates, which is about 13.4%. Heart failure cost the nation an estimated $30.7 billion in 2012. This total includes the cost of healthcare services, medicines to treat heart failure, and missed days out of work. This comes from the Centers of Disease Control from 2021. There's a need for individualized patient education from the beginning of diagnosis. This evidence-based project will provide information to stakeholders on the importance of education programs and the need for streamlining patient education and discharge surveillance for patients with congestive heart failure. My PICO question that I originated the project for was, for adult congestive heart failure patients in the home health setting, does the use of daily weight monitoring and the use of diuretics reduce the future risk of hospitalization compared with adult patients lacking education and intervention for daily weight monitoring, edema, and weight gain of 3 pounds in a 24-hour period or a weight gain of 5 pounds in a 1-week period? The purpose of this evidence-based practice project: research has found that there's a lack of adequate nurse-led programs for educating patients on congestive heart failure and surveillance programs in home health for appropriate management of the disease. Nurse-led education programs and surveillance programs have helped in decreasing readmission rates. A literature review and gap analysis for this project uncovered a need for additional processes and programs for thorough education and surveillance programs before discharge and in the home to aid in proper patient disease process management for congestive heart failure. This project aims to justify the need for individualized education on congestive heart failure and an evaluation plan to ensure patients possess the ability to manage their disease in the home. The evaluation process. How will I go about evaluating stakeholders' knowledge? So patients will be given a pre-test PowerPoint education in service on congestive heart failure and the management of their disease, and they will be given a post-test. Patients will be evaluated for retention of disease process management information and the ability to understand how to manage their disease. Cognitive ability and compliance will be evaluated monthly by home health and telehealth nurse-led programs. So this slide is an opportunity to forecast where you go from here. Does there need to be more education? Do revisions need to be made in either the processes or delivery? Research should be performed by completing additional literature reviews and gap analysis processes. The patient education process should be evaluated for efficacy and developed for cognitive and cultural understanding. Revisions will be required for education processes, surveillance programs, and mode of delivery. These are the references that I utilized during my literature review, gap analysis, and evaluation process. Thank you. So during MN 603 for Purdue Global University, I will be utilizing an evaluation process thoroughly and discussing how I will go about letting the stakeholders know, and administration, nursing, and physicians on how the process should be completed for home health education and for congestive heart failure management for the patient and for the hospital and the Visiting Nurse Association.